PAHO is pleased to be part of the Regional Overview of Food Security and Nutrition 2021. This joint UN report calls for urgent actions to counter the rise in hunger, food insecurity, and malnutrition in all its forms in the region of the Americas. Optimal nutrition is essential for all throughout the life course. This report reveals a worrying rise in the rates of hunger and poverty that prevent people from enjoying essential rights. Despite the effort of many countries in the region, malnutrition in all its forms, including increasing rates of obesity and overweight, continues to threaten the health and well-being of our populations. In recent years, several factors have resulted in the delay or even reversal of efforts to eradicate hunger, food insecurity, and all forms of malnutrition by 2030. The root of many of the most pressing threats to human, animal, and planetary health have been unhealthy, inequitable, and unsustainable food systems. The COVID-19 pandemic has only made these situations worse, reducing household food security, availability, and affordability of healthy food, and access to essential nutritional services. 4 out of every 10 people in the region, 267 million, experience moderate or severe food insecurity in 2020. 60 million more than in 2019. In addition, overweight in children has been increasing over the past 20 years. And in 2020, 3.9 million children, 7.5% of children under 5 years of age, were overweight, almost 2 percentage points above the world average. At the same time, the progress in reducing stunting in children and anemia in women of reproductive age has slowed, particularly affecting populations living in vulnerable conditions in the region. PAHO provides guidance and tools that can help policy and decision makers to deliver impact across food systems for better human, animal, and planetary health. PAHO also supports strengthening of primary healthcare systems to institutionalize and scale up essential nutrition actions through a life course approach, including the support for breastfeeding and infant and young child feeding, feeding of low birth weight infants, growth monitoring, assessment and management of wasting, micronutrient supplementation, school food policies, obesity prevention, salt reduction, elimination of industrially produced trans fatty acids, nutritional care during pregnancy and postpartum, nutritional care during infections, nutrition in emergencies, and nutrition for older adults and persons living with specific conditions. That means leaving no one behind. With technical assistance from PAHO, many of the countries in the Americas are adopting regulations which are consistent with the PAHO Plan of Action for the prevention of obesity in children and adolescents. These include improved school food and physical activity environments, taxation of sugar-sweetened beverages, front-of-package warning labels, and regulation of the marketing of foods to children. Furthermore, PAHO supports countries in policies to promote healthier diets by reducing salt consumption and eliminating industrially produced trans fats from the food supply. As countries focus on building back better following the COVID-19 pandemic, it is critical that attention be paid to sustainable food systems that guarantee food security and nutrition for all, so that economic, social, and environmental conditions are not compromised in the future. It is time to get our food systems right, And this is the time to scale up action on nutrition as we reach the halfway point of the UN Decade of Action on Nutrition. We must prioritize human and planetary health and strengthen our commitment to meet the targets of the Sustainable Development Goals, SDG 2 and SDG 3, guarantee good health and well-being. Indeed, the well-being of every human and indeed animal depends on the global food system. And we all have a responsibility to build a world in which no one is hungry, no one is unhealthy from a preventable cause, and no one faces poverty, and indeed that no one is left behind.